51. Which of the following is an early clinical sign of MS? A. Loss of vision in one eye. B. Difficulty breathing. C. Sudden loss of motor function in the legs. D. Nausea and vomiting. Answer: A. Loss of vision in one eye. Rationale: optic neuritis, or loss of vision in one eye, is often an early sign of MS, particularly in relapsing forms. 52. What is the hallmark pathological finding in the brains of individuals with MS? A. Cerebral atrophy. B. Amyloid plaques. C. Demyelinated plaques. D. Cystic lesions. Answer: C. Demyelinated plaques. Rationale: MS is characterized by the formation of demyelinated plaques in the central nervous system, which disrupt normal nerve transmission. 53. Which of the following symptoms is most commonly seen during an MS relapse? A. Progressive difficulty speaking. B. Sudden onset of unilateral weakness. C. Constant dizziness. D. Sudden loss of vision in both eyes. Answer: B. Sudden onset of unilateral weakness. Rationale: during relapses, MS patients commonly experience symptoms like unilateral weakness or paralysis due to acute demyelination of specific areas of the CNS. 54. A 40-year-old MS patient is experiencing slurred speech. This condition is referred to as A. Dysphagia. B. Dysarthria. C. Apraxia. D. Ataxia. Answer: B. Dysarthria. Rationale: dysarthria is a motor speech disorder resulting from weakness or lack of coordination in the muscles involved in speech, which is common in MS. 55. Which of the following strategies is most effective in managing spasticity in MS patients? A. Use of a soft pillow for head support. B. Muscle relaxants such as baclofen or tizanidine. C. Bed rest and limited movement. D. Increased salt intake. Answer: B. Muscle relaxants such as baclofen or tizanidine. Rationale: baclofen and tizanidine are muscle relaxants that help alleviate spasticity, a common symptom in MS patients. 56. Which of the following MS medications is a monoclonal antibody that targets the CD20 positive B cells? A. Natalizumab. B. Ocrelizumab. C. Fingolimod. D. Teriflunomide. Answer: B. Ocrelizumab. Rationale: ocrelizumab is a monoclonal antibody that selectively targets CD20 positive B cells, which play a role in MS pathogenesis. 57. The presence of which of the following antibodies is often detected in the cerebrospinal fluid of MS patients? A. Antinuclear antibodies. B. Antiviral antibodies. C. Oligoclonal bands. D. Anti-acetylcholine receptor antibodies. Answer: C. Oligoclonal bands. Rationale: oligoclonal bands in cerebrospinal fluid are often used as diagnostic markers for MS, indicating immune system activity in the CNS. 58. Which MS subtype involves periods of remission and relapse, with symptoms that often improve between episodes? A. Secondary progressive MSV, relapsing remitting MSC, primary progressive MSD, progressive relapsing MS. Answer: B. Relapsing remitting MS. Rationale: relapsing remitting MS is characterized by episodes of exacerbation, relapses, followed by periods of remission, during which symptoms improve. 59. What is the primary function of interferon beta in the treatment of MS? A. To provide immediate relief from symptoms. B. To increase the production of myelin. C. To reduce the frequency and severity of relapses. D. To improve cognitive function. Answer: C. To reduce the frequency and severity of relapses. Rationale: interferon beta helps to modulate the immune response and reduce the frequency and severity of MS relapses. 60. Which of the following is a common cognitive symptom seen in MS patients? A. Short-term memory loss. B. Visual hallucinations. C. Sensory overload. D. Extreme emotional lability. Answer: A. Short-term memory loss. Rationale: cognitive changes such as memory loss, particularly short-term memory, are common in MS due to demyelination affecting the brain's cognitive processing areas. 61. Which of the following is the most common visual symptom in MS? A. Diplopia, double vision. B. Nystagmus. C. Scotoma, blind spot. D. Total blindness. Answer: A. Diplopia, double vision. Rationale: diplopia, or double vision, occurs due to damage to the cranial nerves responsible for eye movement and coordination in MS. 62. Which of the following medications is used in the acute management of an MS relapse? A. Prednisone. B. Methotrexate. C. Methylprednisolone. D. Rituximab. Answer: C. Methylprednisolone. Rationale: methylprednisolone, a corticosteroid, is often used to reduce inflammation and accelerate recovery during an MS relapse. 63. Which MS medication works by modulating the immune system and preventing lymphocytes from entering the central nervous system? A. Fingolimod. B. Teriflunomide. C. Glatiramer acetate. D. Dimethyl fumarate. Answer: A. Fingolimod. Rationale: fingolimod works by preventing lymphocytes from migrating into the CNS, reducing immune system attacks on the myelin sheath. 64. Which of the following interventions is most effective in preventing complications of immobility in MS patients? A. Regular physical therapy. B. Increased caloric intake. C. High-protein diet. D. Pain management. Answer: A. Regular physical therapy. Rationale: physical therapy helps prevent complications of immobility, such as muscle atrophy and joint contractures, and improves mobility in MS patients. 65. Which of the following is a common symptom of MS-related autonomic dysfunction? A. Tachycardia. B. Bladder dysfunction. C. Visual impairment. D. Muscle spasm. Answer: B. Bladder dysfunction. Rationale: autonomic dysfunction in MS often affects the bladder, leading to issues such as incontinence or urinary retention. 66. Which of the following MS symptoms is most likely to worsen in hot weather? A. Visual disturbances. B. Muscle weakness. C. Cognitive dysfunction. D. Tremors. Answer: B. Muscle weakness. Rationale: MS patients often experience increased muscle weakness and fatigue in hot weather due to Euthoff's phenomenon, where heat exacerbates symptoms. 67. A patient with MS is experiencing difficulty with coordination and balance. This condition is known as A. Ataxia. B. Hemiparesis. C. Nystagmus. D. Dysphagia. Answer: A. Ataxia. Rationale: ataxia refers to a lack of coordination and balance, which is a common symptom in MS due to cerebellar involvement. 68. Which of the following is the most common initial presenting symptom of MS in young adults? A. Numbness or tingling in the limbs. B. Seizures. C. Progressive weakness in one limb. D. Visual changes. Answer: A. Numbness or tingling in the limbs. Rationale: numbness or tingling, often in the limbs, is one of the most common early symptoms of MS, particularly in young adults. 69. Which MS treatment aims to reduce relapse rates by suppressing the immune system with a cytotoxic effect on T cells? A. Alemtuzumab. B. Interferon beta. C. Glatiramer acetate. D. Mitoxantrone. Answer: D. Mitoxantrone. Rationale: mitoxantrone is a chemotherapy agent that suppresses the immune system and is used for aggressive forms of MS to reduce relapse rates. 70. Which of the following is a common early symptom in children diagnosed with MS? A. Progressive loss of vision. B. Persistent headache. C. Seizures. D. Sudden onset of weakness in one side of the body. Answer: B. Persistent headache. Rationale: persistent headaches are common in children with MS, often occurring before other symptoms like weakness or visual disturbances. 71. Which MS symptom is commonly treated with baclofen or tizanidine? A. Pain. B. Spasticity. C. Vision problems. D. Ataxia. Answer: B. Spasticity. Rationale: baclofen and tizanidine are commonly prescribed to reduce spasticity, a common symptom of MS due to muscle stiffness and spasms. 72. Which of the following is a key component in diagnosing MS? A. Presence of neurologic symptoms lasting more than 24 hours. B. MRI showing demyelinating lesions. C. High white blood cell count in the cerebrospinal fluid. D. History of frequent respiratory infections. Answer: B. MRI showing demyelinating lesions. Rationale: MRI showing demyelinating lesions is a key diagnostic tool for MS and helps confirm the presence of damage to the myelin sheath in the CS. 73. A patient with MS experiences progressive muscle weakness in the lower limbs. This is most likely due to A. Optic neuritis. B. Spinal cord involvement. C. Cerebellar damage. D. Cognitive decline. Answer: B. Spinal cord involvement. Rationale: progressive muscle weakness in the lower limbs is most commonly associated with spinal cord involvement in MS, where demyelination of the spinal pathways occurs. 74. Which of the following is a common characteristic of the primary progressive form of MS? A. Periods of relapse and remission. B. Gradual worsening of symptoms without periods of remission. C. Sudden onset of symptoms that improve quickly. D. Complete recovery between relapses. Answer: B. Gradual worsening of symptoms without periods of remission. Rationale: primary progressive MS is characterized by a steady and gradual worsening of symptoms without periods of relapse and remission. 75. Which of the following lifestyle modifications is recommended for MS patients to prevent exacerbations? A. A low-salt diet. B. Regular physical activity. C. High-fat diet. D. Complete bed rest. Answer: B. Regular physical activity. Rationale: regular physical activity can help manage MS symptoms, maintain mobility, and improve overall quality of life by preventing complications such as muscle weakness. 76. Which of the following is a common secondary complication in MS due to prolonged immobility? A. Osteoporosis. B. Hyperglycemia. C. Sepsis. D. Renal failure. Answer: A. Osteoporosis. Rationale: prolonged immobility in MS patients can lead to secondary complications such as osteoporosis due to lack of weight-bearing activity. 77. Which of the following MS medications can cause liver toxicity and requires regular liver function monitoring? A. Fingolimod. B. Teriflunomide. C. Natalizumab. D. Glatiramer acetate. Answer: B. Teriflunomide. Rationale: teriflunomide is associated with potential liver toxicity and regular liver function tests are required to monitor for adverse effects. 78. What is the primary purpose of using corticosteroids such as methylprednisolone in the management of MS? A. To promote myelin repair. B. To prevent the onset of MSC. To reduce inflammation during an acute relapse. D. To prevent secondary complications. Answer: C. To reduce inflammation during an acute relapse. Rationale: corticosteroids like methylprednisolone are used to reduce inflammation and accelerate recovery during MS relapses by suppressing the immune system's attack on the CIS. 79. Which of the following is the best strategy to reduce the risk of MS exacerbations triggered by heat? A. Increase fluid intake and use cooling vests. B. Rest in a hot environment. C. Wear dark clothing. D. Increase caffeine intake. Answer: A. Increase fluid intake and use cooling vests. Rationale: MS patients may experience worsening symptoms in hot environments. Staying hydrated and using cooling methods, such as cooling vests, can help manage heat sensitivity. 80. In MS patients, cognitive dysfunction is most likely to manifest as A. Decreased motor coordination. B. Memory impairment and difficulty concentrating. C. Visual disturbances. D. Difficulty swallowing. Answer: B. Memory impairment and difficulty concentrating. Rationale: Cognitive dysfunction in MS often manifests as memory problems and difficulty concentrating, affecting daily functioning. 81. Which MS medication is known to reduce the number of active lesions and relapses by modulating immune cell activity? A. Dimethyl fumarate. B. Glatiramer acetate. C. Rituximab. D. Natalizumab. Answer: A. Dimethyl fumarate. Rationale: dimethyl fumarate works by modulating immune cell activity and reducing inflammation, thereby reducing the number of active lesions and relapses in MS. 82. A common side effect of interferon beta therapy in MS patients is: A. Decreased appetite. B. Flu-like symptoms. C. Visual disturbances. D. Excessive thirst. Answer: B. Flu-like symptoms. Rationale: interferon beta therapy can cause flu-like symptoms, including fever, chills, and muscle aches, especially when starting the treatment. 83. Which of the following is most commonly associated with MS-related sensory disturbances? A. Numbness and tingling. B. Vomiting. C. Seizures. D. Shortness of breath. Answer: A. Numbness and tingling. Rationale: MS often causes sensory disturbances such as numbness and tingling, especially in the limbs, due to demyelination of sensory pathways in the CNS. 84. Which of the following is an appropriate nursing intervention to manage fatigue in MS patients? A. Encourage rest and frequent naps during the day. B. Advise patients to increase physical activity until exhaustion. C. Restrict fluid intake to reduce the need for bathroom visits. D. Advise patients to stay in bed as much as possible. Answer: A. Encourage rest and frequent naps during the day. Rationale: fatigue is a common symptom in MS, and regular rest and pacing activities can help manage fatigue without overexerting the patient. 85. A 45-year-old MS patient reports worsening vision and diplopia. What is the most likely cause? A. Increased intracranial pressure. B. Optic neuritis. C. Vitamin B12 deficiency. D. Chronic fatigue. Answer: B. Optic neuritis. Rationale: optic neuritis, an inflammation of the optic nerve, is a common cause of visual disturbances, including diplopia, in MS patients. 86. Which of the following is an appropriate teaching point for MS patients regarding their immune system? A. You should avoid all vaccines. B. MS treatment suppresses your immune system, making you more susceptible to infections. C. You should take antibiotics regularly to prevent infections. D. MS patients have an overactive immune system. Answer: B. MS treatment suppresses your immune system, making you more susceptible to infections. Rationale: many MS treatments suppress the immune system, increasing the patient's risk of infections. It's important to monitor for infections and practice good hygiene. 87. Which of the following is a typical feature of MS-related bladder dysfunction? A. Incontinence and urinary retention. B. Frequent urination at night. C. Painful urination. D. Increased urine output. Answer: A. Incontinence and urinary retention. Rationale: bladder dysfunction in MS often results in a combination of urinary retention and incontinence due to impaired neural control of the bladder. 88. The use of which of the following medications may increase the risk of infections in MS patients? A. Vitamin D supplements. B. Immunosuppressive drugs like methotrexate. C. Over-the-counter analgesics. D. Antihypertensive drugs. Answer: B. Immunosuppressive drugs like methotrexate. Rationale: immunosuppressive drugs, such as methotrexate, can increase the risk of infections by suppressing the immune system. 89. Which of the following is the most common emotional symptom experienced by MS patients? A. Hyperactivity. B. Depression. C. Mania. D. Paranoia. Answer: B. Depression. Rationale: depression is a common emotional symptom in MS patients, often due to both the direct effects of the disease on the brain and the emotional toll of living with a chronic condition. 90. Which of the following best describes the nature of MS relapses? A. Gradual onset of symptoms. B. Symptoms appear suddenly and last for days to weeks, followed by improvement. C. Symptoms worsen slowly and progressively. D. Symptoms occur intermittently, without any pattern. Answer. B. Symptoms appear suddenly and last for days to weeks, followed by improvement. Rationale. MS relapses are characterized by sudden onset of symptoms that last from days to weeks and improve with or without treatment. 91. Which of the following is a typical diagnostic finding in MS? A. Presence of antibodies to acetylcholine. B. Elevated cerebrospinal fluid, CSF, protein. C. Decreased white blood cell count in CSF. D. Presence of demyelinating lesions on MRI. Answer. D. Presence of demyelinating lesions on MRI. Rationale. The most common diagnostic finding in MS is the presence of demyelinating lesions on MRI, which indicates damage to the myelin sheath in the CSF. 92. Which of the following MS medications works by inhibiting the migration of immune cells across the blood-brain barrier? A. Interferon beta. B. Dimethyl fumarate. C. Fingolimod. D. Teriflunomide. Answer. C. Fingolimod. Rationale. Fingolimod works by inhibiting the migration of immune cells across the blood-brain barrier, reducing inflammation and relapses in MS. 93. Which of the following is an important nursing consideration for a patient receiving interferon therapy for MS? A. Monitoring for liver toxicity. B. Assessing for symptoms of deep vein thrombosis. C. Regular monitoring of blood pressure. D. Encouraging fluid intake to prevent dehydration. Answer. A. Monitoring for liver toxicity. Rationale. Interferon therapy can cause liver toxicity, and patients on this medication require regular liver function tests to monitor for adverse effects. 94. A 30-year-old woman with MS reports frequent urinary urgency and difficulty voiding. What is the most likely cause of these symptoms? A. Bladder dysfunction due to demyelination. B. Urinary tract infection, UTI. C. Side effect of disease-modifying therapy. D. Psychological stress. Answer. A. Bladder dysfunction due to demyelination. Rationale. MS-related bladder dysfunction often results from demyelination in the spinal cord, which affects the bladder's ability to store and void urine properly. 95. Which of the following is the most common type of MS? A. Primary progressive MSB, secondary progressive MSC, relapsing remitting MSD, progressive relapsing MS. Answer. C. Relapsing remitting MS. Rationale. Relapsing remitting MS is the most common form of MS, characterized by flare-ups, relapses, followed by periods of remission where symptoms partially or completely improve. 96. What is the primary role of a nurse when caring for a patient undergoing a lumbar puncture to diagnose MS? A. Administering sedatives. B. Ensuring the patient stays hydrated. C. Assisting with positioning and monitoring for complications. D. Providing a blood transfusion if necessary. Answer. C. Assisting with positioning and monitoring for complications. Rationale. The nurse's primary role is to assist the patient in assuming the correct position for the procedure and to monitor for any complications, such as post-lumbar puncture headache or infection. 97. Which MS symptom is most often exacerbated by stress, heat, or infection? A. Cognitive dysfunction. B. Visual disturbances. C. Muscle weakness. D. Fatigue. Answer. D. Fatigue. Rationale. Fatigue is a common symptom in MS, and it is often exacerbated by stress, heat, or infection, which can contribute to worsening of other MS-related symptoms as well. 98. What is the purpose of using disease-modifying therapies, DMTs, in MS treatment? A. To cure MS and restore lost function. B. To reduce the frequency and severity of relapses. C. To improve the patient's vision. D. To prevent the progression of cognitive decline. Answer. B. To reduce the frequency and severity of relapses. Rationale. Disease-modifying therapies, DMTs, are used to reduce the frequency and severity of MS relapses and slow disease progression by modifying the immune response. Answer: B. Spasticity and difficulty walking. Rationale: spasticity and difficulty walking are common MS symptoms that can be addressed with physical therapy to improve mobility and function. Answer: B. Spasticity and difficulty walking. Rationale: spasticity and difficulty walking are common MS symptoms that can be addressed with physical therapy to improve mobility and function. 100. Which of the following is a common cause of MS-related visual disturbances? A. Optic neuritis. B. Retinal detachment. C. Cataracts. D. Macular degeneration. Answer: A. Optic neuritis. Rationale: optic neuritis is an inflammation of the optic nerve and is a common cause of vision problems in MS, often presenting as blurred vision or color vision defects.